My name's Carrie. I'm the owner of Cedar Counseling and Wellness. We opened in June, so we're a new practice. I graduated with my master's in social work in 2008, and I've been in the field doing various things since then. Before I opened the practice, I'd spent about 3.5 years at a private practice elsewhere. And then before that, I was doing a lot of substance abuse work. So I'm really familiar with the field of addictions as well. Just to give you a little bit of background. At Cedar right now, we have, including myself, we have 3 therapists, and then we have a dietitian. So I do a lot of work in treating anxiety, which is a really common, prevalent issue these days. And I also work on rebuilding relationship with self. So that's, self-compassion, self-worth, self-love, self-image, self-confidence, anything that, if you felt like your relationship with your own self has been broken down, I work to build that back up.
Right. Can we talk a little bit about kind of some of the things that, especially as women, that occur in our life that kind of make us lose that sense of self?
Oh, absolutely. It's almost easier to ask like what doesn't so often all of our experiences, no matter what our issues are, all of our experiences factor into how we view the world and how we view ourselves. And I think that we as women in particular, internalize those external experiences. And, we believe that we're not good enough when we're mistreated, or we believe that we're not good enough if we've failed in some way, or we perceive that we've failed in some way, right? So traumatic experiences that might have happened to us, negative relationship experiences, maybe we're in an abusive relationship or a relationship where we just weren't even respected or treated as well as we should have been, extended family dynamics, all of these things factor into our sense of self, and then how we feel in relation to the world around us.
Right. Makes total
So,
sense.
yeah.
Awesome. So cool. So you mentioned at Cedar, there's also a nutritionist. So it sounds like in addition to the therapy aspect, there's also someone to help you. I mean, with anxiety, especially, sometimes diet can. Uh,
Yeah, so that's my hope was to address it more holistically, and as we grow, I want to really grow that holistic perspective, but it's all so intertwined. When I was treating anxiety, I realized how physical anxiety is, and the interconnection between our physical selves, our spiritual selves, our emotional selves, our social selves. It's all intertwined. And so having a dietitian come on staff kind of felt such a natural extension to me of all of those. And she addresses a lot of the manifestations of eating disorders and things. And that's another element of when we're struggling with our emotions, how do we respond? And some people respond with addictive behavior. Some people respond with eating disorders. And I just didn't feel equipped to hit I would see it in session with my clients who were struggling with body image, and their relationship with food was very broken. And I didn't feel completely equipped to handle it from all angles. So bringing on a dietitian is so helpful.
yeah, that's so wonderful to know the areas that maybe, not that we're lacking in, but maybe the areas that we aren't fully equipped to handle. And
Yep.
then instead of just saying, sorry, I don't know the best way to handle that, you pull in those other resources.
Exactly. And she's been so fantastic. So just to give you a little bit on her, she came from a residential facility for eating disorders. So her background is primarily eating disorders. She does a lot of disordered eating, chronic dieting. Her focus is on intuitive eating, so rebuilding that connection with your body so that you can listen to your internal cues. And mindful eating. She's also a yoga instructor, which is really cool. So she kind of has this mindful movement incorporated into her recovery, mindset mentality. So
Yeah, that's great. So in terms of the things that you can help people with, you've mentioned the eating disorders, you've mentioned the anxiety. Do you deal with addiction still if people are dealing with addictive behaviors?
So I would definitely say that we're at least dual diagnosis. We're probably not like, if someone is only presenting with substance abuse, that's probably not where our niche would be. But we definitely, it's usually in conjunction with, like in conjunction with trauma or with anxiety or with depression or something like that. And I absolutely have cases like that on my client load. So.
Great. For a moment, would you mind? So I'm finishing my social work degree too, which I'm like super excited about. But what I have found is that oftentimes we come up with the question of, I'm looking for a psychiatrist or I'm looking for a psychologist. And sometimes people don't understand the difference between a psychiatrist and a psychologist. We have to say, well, one is a more medical doctor, they prescribe medication.
Yeah.
But a lot of people don't understand that a social worker is not just Department of Social Services.
Oh my gosh, yes. No, the distinction is it's so funny. And I've had clients that scheduled appointments with me, like thinking accidentally that I was like a psychiatrist and that I would be prescribing medication. I'm like, no, that's not what we do. Right. But yeah, I mean, of course, like with psychiatry, you're going to get more of the medication management piece. Mm-hmm. That's something that they're uniquely equipped to do. I do know some psychiatrists that are willing to incorporate therapy also into their time with you. Great. Yeah. I love that.
I do find that's not the norm here though.
Yeah, definitely. Most of them, it's like the 15-minute, right? Like checkup appointment.
Yeah.
And then, a psychologist, I think one interesting thing that they do is like more testing. Mm-hmm. And then I think from a social work perspective, we're more, we can be in, a social service setting. I think that's and since you're studying social work, this is what I love about social work. It's so diverse. Like there are so many things that you can do with the degree. So if you really want to do medical social work, you can do that. You can be in like a hospital setting. If you wanted to do primarily adoption work, you could be in that arena. But, then there is this like entire clinical path that really prepares you to be a solid clinician. And that's sort of the path that I've decided to take. That was what I felt passionate about. So
yeah, I'm so excited you mentioned that you were at master's level in social work, because I think it's so important that people understand, because a lot of the resources we give, a lot of the counselors and therapists, many of them are social workers. And sometimes people will say, oh, well, I think I'm looking for a psychologist instead. And what I want people to understand is that trained social workers,
100%.
Maybe even you can kind of explain that, like, you go through so much training.
Absolutely. Yeah. We're coming out of, of course, our 4-year undergraduate program plus a 2-year graduate program. We have rigorous clinical expectations during that time. I think that my program required like 1,100 clinical hours. And then afterwards, we're supervised by another social worker for an additional at least 2 years full time. So really there's so much training and prep work that goes into this. And there are some therapists that let's be real, there are some therapists that maybe shouldn't even have their licenses. Like I've met those therapists, right? They're therapists that aren't seeking growth and development and opportunities. And unfortunately, my clients will sometimes come in almost traumatized from prior bad experiences in therapy, but I would 100% say that the average social worker who's studied this path, like the clinical path, they're well equipped to handle anything that's thrown at them, like as far as anxiety, trauma, addictions, depression, all of it. Like they should be able to handle it, no problem.
Yeah. I think it's great to just like put it out there that depending on our own unique needs, we have many different clinicians, whether they're social workers, whether they're psychologists, whether they're psychiatrists, whether they're dietitians, nurse practitioners. All of these people can be part of our care team. And like one bad experience doesn't mean that therapy is not going to work for you. I think many of us have had that experience where we've tried therapy and we've gone,
this isn't right. This isn't right. Which is this one thing that I love that you always say in the Facebook group, like it's about the fit.
Yeah.
It really is about the fit. It's so hard. And I have so much compassion for these individuals who are reaching out and asking for help, because it is so hard to finally ask and finally seek help. And then if you encounter the first therapist that you encounter doesn't happen to be a solid fit for you, it's really discouraging.
Yeah.
And so I get that, but like from my perspective, it's a lot easier for me to say than it is for, them to do. But you have to shop around. You have to be willing to like, get the word of mouth referrals, call around, email, look at bios. Like you really have to be willing to find that fit. But it's like dating. Just because you haven't found it yet doesn't mean that it's not out there. Like it's, I really think that there's a therapist for everyone, but sometimes it's not the first therapist.
Yeah, it takes time to find the right fit, and it definitely is a personal relationship. I always kind of joke when I struggled with postpartum depression, and the first time I didn't seek help, but my second pregnancy, I was like, you know what, I'm gonna like hit this head on. I'm gonna go see a therapist, and the very first therapist I saw, I walked in, and I'm in tears at this point still because I'm just like a wreck. And I sit down, and the first thing she said was she put her hand on my shoulder and she goes, "I have 3 dogs. I know exactly what you're feeling." And I was like,
Oh no.
what? Like, okay, I don't think we're gonna work. But it was so funny, and I didn't just give up. I found somebody else to help me through it. But it's kind of a comical expression, like, just because the first person doesn't get you.
100%. And yes, and I have heard so many of my clients come with similar stories, like, you'll never believe what this therapist said. And I'm always like, no.
Right. Right. And we're all human, we're all human. And, maybe that would have been a great icebreaker for somebody. Didn't work for me. Or, maybe it's one of those things where I think actually one of my classes, we had talked about it too. It's like those foot and mouth moments where you're like,
oh my gosh,
I said that. Why would I?
Yes, exactly. Well, and we've all been there. Everyone has, like, whether you're on the receiving end or the giving end, we've all been there. We're like, oh my gosh, did that just happen?
Exactly.
So I guess I could just tell you also really quickly that we also have 2 other clinicians, Casey and Caroline. Casey Gunther specializes in anxiety and depression, and she comes more from like a CBT and solution focused lens. And then Caroline specializes in trauma and chronic stress. She does a lot of like primary trauma, but also secondary trauma, like vicarious trauma, caregiver stress, things like that. So maybe first responders who've been traumatized from a situation they've either witnessed or heard about, like that. That's sort of that's her jam. And we're really trying to, my hope is each clinician that we're bringing on is very targeted and very intentional. Like we're trying to fill a space and like, what are the needs that the community has? Like what do I know people are struggling with, and how can we make sure that we are well equipped to help those individuals?
Right. What a great approach. So if you could give just any little kind of bits of advice or wisdom for people right now, because mental health has always been a thing. It's always been something we need to address.
But this year, it
feels like 2020 is like,
oh my goodness, right? Okay, well, this year has been so hard for almost everyone. I think I've heard like 2 people say this has not been a harder year for them than most. So, and that's out of like hundreds of people.
Right.
So this has been such a hard year. And I think that even historically in regular years, holidays are difficult.
Mm-hmm.
So I think the thing that's been on my mind is how do we prepare for the holiday season in 2020 when chaos has been like the norm?
Right.
And what do we do to not further lose our minds? And I think the best thing that I can say is be mindful of what we can add to our lives that brings us joy, meaning, purpose, fulfillment, relaxation, peace. Like, what are the feelings that you really need to find, and how can we intentionally go out, create those, seek those experiences, like to provoke those feelings within ourselves? So, maybe that's self-care, maybe that's meditation, maybe that's physical exercise, maybe it's talking to a friend, going for a walk, whatever it is that we need to do, like achieve adding something good into our lives. Right. And then also offering permission to remove things that are going to be detrimental to our mental health right now. And sometimes that's saying no to an activity, it's saying no to a person, it's saying no to something that might add stress in a really, really, really stressful year, and that might just be the cherry on top that we can't take anymore. So I think the big thing is giving yourself permission. I want people to know they have permission to say no if it means they need to say yes to themselves, if that makes sense.
Oh, that makes total sense. I love that. Yeah. Saying no so you can say yes to yourself. That's a
Yeah.
beautiful thing. Um, I think too, we put too much pressure on ourselves sometimes, especially around the holidays, to make everything perfect.
Everything perfect,
There's
everything. And that's the kind of stuff we need to say no to, I think, this year. I think we need to reset our expectations for ourselves, not be so hard on ourselves. Maybe we don't. Maybe we don't plan as many activities, or maybe we don't push as hard for it to be like Instagram worthy experience, but like boil it down to what do we need, right?
yeah.
Instead of what might look pretty, or I just think that we need to. So sometimes it's saying no to all of the fluff.
No, that makes total sense. I mean, even with like small things, like for instance, my kids, they love the gingerbread houses, and for some reason, like it just really stresses me out because I know that I'm going to be the one who has to get stuck trying to put it all together, and I'm really bad at it, and they always collapse and fall down. And so this year, I was like, we're not doing gingerbread houses. We're decorating sugar cookies. It was a super simple, like
Yep.
little switch. Because we go away for Thanksgiving, and I always like pack their gingerbread house stuff so we can do
Yep.
it the day after Thanksgiving. And I was like, I'm not doing the gingerbread houses this year. It's a disaster every year. I'm doing sugar cookies. And that was a super simple replacement, but
But
like
I love it because
the
it's
easy
it's
version was
it's giving yourself permission to let go of something. And I think sometimes, and that goes back to like what I like to work with, is rebuilding your relationship with yourself. That it's okay to say no without beating yourself up. Because
yeah.
sometimes we as moms, we're like, oh, does that make me a bad mom? No, no, absolutely not. Like, in fact, maybe it makes you a better mom because you're not stressing out. Like,
Right, right. Exactly. A stressed mom is not her best self.
yeah.
So
So,
yeah, I love it.
so
That
I
was
love that. So I would say focus on adding in some things that are intentional and removing some things also intentionally that just they're not good for you this year. It's not the right fit.
awesome. I love it. Thank you so much. I really appreciate you taking the time to share all that with us.
Yeah, thanks for having me. I mean, it was kind of fun to connect.
Of course, it was.